next, another community leader from here in the Merrimack Valley, Joe Demore. Joe launched a humanitarian project in 2014 to address food insecurity among our vulnerable populations facing conditions such as unsheltered homelessness. And the project has evolved into a sustainable year-long food service at GAR Park in Haverhill. Joe is also the creator of the blog, The Humanitarian Effect, where he has transformational conversations about using social justice as the means to lift up those who are most vulnerable. His work during the COVID-19 emergency has really helped so many families, and I'm so grateful to Joe and to have you here today. So, Joe, thanks so much for joining us. I just wanted to introduce you and ask, I guess we can start off with the first question. What have you found to be the greatest needs for the homeless and persons in poverty during this pandemic?
Well, thank you, Senator. First of all, thank you for always, you've been amazingly accessible. We've been working together in outreach for 5 years now, and I can't even vote for you unless you buy a house in Groveland. But the vulnerable populations today are, has expanded the definition. We had unsheltered homeless, people that live outdoors, and we have sheltered homeless, people that live in emergency shelters. Now vulnerable populations are children and senior citizens that are unable to spend quality time with their family. They're isolated in their rooms in nursing homes and long-term care facilities. So we have definitions. We're inventing definitions with COVID-19. So my group is a humanitarian project, and I'm very proud to have several types of missions. One of the most prominent ones in your area is we work with the DCF in Lawrence. And this was a program that was launched with my partner, Katie Cook of Comfort Homes in Methuen. And what we do is we provide the most basic needs, mostly clothes, for children that find themselves, because of protective custody or emergency court order, find themselves suddenly within 24, 48 hours in a foster home. That's been an ongoing program. We have so-called angels that are involved. So what we did now for COVID-19 is we had to shut down some of our regular missions. The food service program has been transitioned to the local pantries. So we got busy, and my partner Eva Montebello from Haverhill and Robin Hudson from Merrimack launched the Sewing Angels program. And what we did is we gathered a group of people that were willing to and able to sew masks. We actually launched this program on March 21st. We have about 28 people that are sewing for us, and we're producing face masks that we use a Deaconess Hospital pattern, but it is a non-medical mask. Of course, we started this a few weeks ago, and we also, within our group, we have some people that have been buying materials. For example, elastics are really hard to come by, fabrics and threads, but thankfully we started buying 5 weeks ago, so we've never run out of supplies. So I take a count every Sunday night, the official count, not the amount of masks that have been produced, but the amount that have been distributed. And as of Sunday night, our little group has distributed 3,792 masks.
Wow.
We're going to go over 4,000 this week. And distribution means that we've identified nursing homes, long-term care facilities, councils on aging within the district, and we ask them, how many masks do you need? And we fill orders. And because we've been sustainable in our program, I had the courage, encouraged by the Sewing Angels and the people that are involved. They said, we can continue to produce, so it's okay for you to reach out and take orders for individual families. So 2 weeks ago, we actually launched that program as well. Dee O'Neill from Haverhill has been responsible for distributing about 1,000 masks in Haverhill, and more than half of them were delivered either by her or a group of folks that she put under her wing. So it's just been unbelievable. And I think this is going to go on a little bit longer than we all hoped for, but I'm glad to be part of the solution. It makes things easier, for sure.
Well, we're glad to have you being part of the solution as well, Joe. If somebody wants to get involved and they want to help and they want to volunteer with you, can they get involved in the Sewing Angels initiatives or
Sure.
the other things that you're doing if they'd like to participate in that?
Sure. The focus right now is the Sewing Angels program. So there's three types of people that are involved. Those that are able and willing to sew, those that are willing to run, we call them runners, pick up supplies, drop off supplies, pick up masks, deliver them to councils on aging or nursing homes or even individual homes. And then we need shoppers, incredibly. If we had not thought about buying elastics 5 weeks ago, we would have ground to a complete halt. My own order for elastics came in last week and I placed it 4 weeks ago.
Wow.
So one of our volunteers said, listen, let's just forget about what eBay or Amazon delivery date is. Just ignore the date and buy. And thankfully that caused, with 11 or 12 people buying, that caused, a continuous flow of supplies. Now this week we're going to retool. Some of our Sewing Angels are going to start producing surgical caps and also masks for small children. Children that are perhaps 10, 12, 13 years old, if they're not sick, possibly they can postpone their annual physical, but very young children have to be vaccinated. There are required doctor's visits for young children. So we're going to now begin our focus this week on providing face masks for children as well. So anybody that can sew, that wants to run or provide us with supplies, give me a call, 617-791-2218, and we'll get you integrated.
Thanks, Joe. And thanks for pointing out you don't technically live in the first Essex district.
That's right.
You spend, it seems like, most of your time here in the greater Haverhill, greater Lawrence area. And we couldn't express, we couldn't be more grateful to you. So we appreciate your collaborative efforts with the volunteers across the region, across the Merrimack Valley. You do a lot, your organization does a lot. And thank you for that information on how to get involved. Keep up the great work. And we will definitely be in touch about those masks. I want to make sure that I order some of those as well. So appreciate
Great.
what you do.
Thank you, Senator, and be well. Appreciate everything.
Thanks, Joe. Take care.
Okay. All righty. Bye-bye.
Now, I'm so happy to be joined not just by one,